Welcome. This video will explore peripheral artery disease, or PAD, a common yet often underdiagnosed condition affecting millions. We'll delve into what PAD is, its causes, how it affects your body, how it's diagnosed, treated, and most importantly, how to prevent it. Let's begin our journey to understand PAD. So what causes PAD? In the vast majority of cases, PAD is caused by atherosclerosis. Think of atherosclerosis as a buildup of plaque made of cholesterol, fat, calcium, and other substances inside your arteries. Over time, this plaque hardens and narrows the arteries, reducing blood flow to your limbs, most commonly the legs and feet. While atherosclerosis is the primary culprit, other less common causes include blood vessel inflammation, injury to your limbs, abnormal anatomy of ligaments or muscles, and radiation exposure. Now, let's talk about how PAD works. When atherosclerosis narrows the peripheral arteries, it restricts the supply of oxygen, rich blood to your muscles and tissues, especially during activity. This lack of blood flow, called ischemia, is what leads to the hallmark symptom of PAD, intermittent claudication, or pain in the legs with walking. If the blockage is severe, or if blood clots form in the narrowed arteries, it can lead to critical limb ischemia, a more serious condition that can cause pain at rest, non-healing sores, and even tissue death, known as gangrene. PAD is a widespread health issue. It's estimated that millions of adults in the United States alone are affected by PAD, and the prevalence increases with age. People over the age of 50 are at higher risk, and certain groups, including African Americans, are disproportionately affected. Furthermore, PAD often goes undiagnosed, as many individuals may not experience noticeable symptoms, or they may attribute their leg pain to other causes, such as arthritis or simply getting old. What should you watch out for? The most common symptom of PAD is intermittent claudication. This is a cramping pain, aching, or fatigue in the legs or hips that occurs during exercise, such as walking, and is relieved by rest. The location of the pain depends on which artery is affected. Other symptoms include numbness or weakness in the legs or feet, coldness in the lower leg or foot, changes in the color of your legs, sores on your toes, feet, or legs that won't heal, hair loss or slower hair growth on your feet and legs, slower growth of your toenails, and a weak or absent pulse in your feet or legs. In men, PAD can sometimes contribute to erectile dysfunction. So, how is PAD diagnosed? Diagnosis often starts with a physical exam, where your doctor will check the pulses in your feet and legs. They may also listen to your arteries with a stethoscope for any abnormal sounds, called bruits. The ankle brachial index, or ABI, is a common, non-invasive test that compares the blood pressure in your ankle to the blood pressure in your arm. A lower ABI suggests PAD. Other tests include ultrasound, which can visualize the arteries, and blood flow angiography, which uses dye and X-rays or MRI to get a detailed picture of the arteries, and blood tests to check for risk factors like high cholesterol or diabetes. While PAD doesn't have strict types, in the same way as some other diseases, it is categorized by severity. The Rutherford classification is often used, ranging from Category 0, which is asymptomatic, to Category 6, which involves severe tissue loss and gangrene. The Fontaine classification is another system, focusing on the degree of claudication and presence of rest pain or ulcers. These classifications help determine the appropriate treatment strategy. The goals of PAD treatment are to relieve symptoms, slow the progression of atherosclerosis, and reduce the risk of heart attack and stroke. Lifestyle modifications are key, including quitting smoking, eating a healthy diet low in saturated fat and cholesterol, and regular exercise, especially supervised exercise programs. Medications can help manage risk factors like high blood pressure, high cholesterol, and diabetes. Antiplatelet medications like aspirin or clopidogrel can help prevent blood clots. In more severe cases, procedures to open blocked arteries may be necessary. These include angioplasty, where a balloon is used to widen the artery, often with the placement of a stent to keep it open, and bypass surgery, where a new route for blood flow is created around the blocked artery using a graft. The best way to manage PAD is to prevent it in the first place. This means controlling risk factors. Don't smoke. Smoking is a major risk factor for PAD. Manage your blood pressure and cholesterol levels through diet, exercise, and medication if necessary. Control your blood sugar if you have diabetes. Maintain a healthy weight and engage in regular physical activity. By adopting these healthy habits, you can significantly reduce your risk of developing PAD. The prognosis for people with PAD varies depending on the severity of the condition and the presence of other health problems. With early diagnosis and treatment, many people with PAD can manage their symptoms and prevent serious complications. However, PAD is often a marker for more widespread atherosclerosis, increasing the risk of heart attack and stroke. Recent research is focusing on developing new medications and less invasive procedures to improve blood flow to the limbs and reduce the risk of amputation. Researchers are also investigating the role of inflammation and genetics in the development of PAD, which could lead to new prevention and treatment strategies in the future. Thank you for watching.